Hi, today I'm going to discuss nonquad with you. And so we're going to talk about what is nonquad, and then we're going to discuss what causes nonquad, and finally we're going to discuss how to manage it. And the nonquad is the patient who is not recovering after more than 3 weeks following the start of quad symptoms. And we know that in the normal case, the patient should recover within 2 weeks of after they get this quad. And so as the case is developing, and about 25% of all patients actually cannot recover after more than 3 weeks. So they have some people even have 3 months, 6 months, and 9 months. They still have kind of quad symptoms. And of course, the reason is very complicated. We can just do some speculation based on what we have. The first component for this reason may be the virus factors. And in the early phase, maybe this live virus, the virus is still in the human body. But this for the non-quad, this is unlikely because after 2 or 3 weeks, human body should have the immunity against this virus. So the live virus have very limited chance to survive. So the major reason can be in terms of virus factor is the virus, because when the virus replicate in the human body, it generates a huge amount, and the human body destroy the virus. However, then it takes time to clear the virus from your body. So more likely is because the degraded virus product in a lot of proteins, and some of those nucleic acid. Another more important component is the human component. We know that after virus infection, the human body and create huge response to this virus infection, try to fight against virus. That cause hyperinflammatory reaction to the virus. So this virus infection leads to much greater production of cytokines and contribute to this cytokine storm. And this cytokine storm can lead to systemic inflammatory response and also multi-organ injury, shock, and even death. And what I want to point out is that inflammatory response may continue to increase, even so the virus load, means the live viruses go drop or even not presented. And because still have a lot of viral proteins in the human body, this can still continue to stimulate human body to get hypoimmune response. And so we know that the virus can infect almost all organs in the human body. They can infect lung, heart, brain, kidney, liver, intestine, and all organs, because all our cells have this receptor for this virus, ACE2. And we all know that lung is the respiratory tract is the location for the virus to get into the human body, and they can infect almost all this respiratory tract and cause a non-function failure. And also we know that the virus can affect heart and cause heart failure, and the virus also can cause encephalitis. And we know that most patients of quad-19 have some kind of psychological issues, and that may also related virus infection of brain, which cause stress and depression and anxiety. And of course, that virus can also infect kidney cells and cause renal failure. And in some cases, this is the cause of patient died of this quad-19. And we know that the virus can get into this gastrointestinal system, cause a lot of symptoms on the digestive system like diarrhea, pain in the stomach. And you can see that the entire system is very, very complicated and involve both virus and the human body. And that's why I cause nonquad. So after short terms of quad-19 infection, and however, in the human body, you still have degraded viral product, and this hyperinflammatory reaction to the virus or to the virus product, degraded viral products continue. And the organs still need to take time to recover it, to clear this all this product from the human body. So the reason for non-quad does include virus component and human component. So how are we going to manage the non-quad? And this is the area which is every day have something new come out. And because right now there's no any specific treatment for this kind of symptom for non-quad, because everyone have different symptoms. And for the antiviral treatment, after 2 or 3 weeks, the human body already generated this immune system. I think the virus is already cleared. So we don't need antiviral treatment. Only thing we need treatment is that need to suppress the inflammatory response. So maybe if you're very severe, you may use dexamethasone, and that's a steroid for suppress the inflammatory response. But this steroid cannot use for too long time, because this if you use more than 2 weeks, there are a lot of side effects. So as I mentioned, that from right now, and doctors have no specific treatment for non-quad. Only things that to the symptoms. If you have fever, and then maybe you can use fever, some drug to reduce your fever, or fatigue. And in terms of fatigue, it's one of the most important symptoms, and so the patient know yourself the best. So basically, you need really to work out your own schedule, and you need to have physically prepare for such kind of illness, mentally, and also psychologically. So you need. We know this is tough illness, but you need to prepare for yourself, because you know best yourself. And of course, you need support from professionals. But the best thing is that you need to have your own strategy and try to come positive attitude. Come out with your own strategy. Whatever you can deal with all this non-quad symptom like fatigue, fever. Unless you have very, very clear symptom, then you need to seek professional help. And but I'm right now that many people, professionals, work very hard on this issue, but try to follow most recent development in this area. Maybe something come out, it can give you great help. And that's the talk for today. And I wish everyone be happy and healthy. And I wish to see you in my next video. Bye.